right. Thank you so much, everyone, for joining us for today's panel, Caring for the Caregivers. Throughout today's event, we invite you to share your comments and questions. Please go ahead and locate the comments area on your screen. And if you think of a question for the speakers at any point, just go ahead and type it there. I will be monitoring the chat for questions and will ensure that your questions get asked in the discussion portion at the end of the event. So without further delay, our presenters today are Amy Hendrix, April Merrill, and Dr. Michael Baxter. As a child abuse pediatrician, Dr. Michael Baxter has years of personal experience in a profession with constant exposure to secondary trauma. He has presented at the local and national level regarding the impact of STS on professionals that are exposed to it. He has previously led courses for the Tulsa Children's Advocacy Center's multidisciplinary team, staff and attorneys at Legal Aid Services of Oklahoma Tulsa Law Office, and social workers embedded within OU-Tulsa clinics. He's currently the principal investigator of a study evaluating the impact of a compassion fatigue program for helping professionals. April Merrill is the state director, lead attorney of the Medical Legal Partnership of Legal Aid of Oklahoma, with an office located in the General Pediatric Clinic at OU-Tulsa. She has been a practicing attorney in the Tulsa area since 2010 and works closely with the clinical social workers within the pediatric clinic at OU-Tulsa. She is currently the co-principal investigator of a study evaluating the impact of a compassion fatigue program for helping professionals. She has presented at the local and national level regarding the impact of STS on professionals that are exposed to it. She has previously led courses for staff and attorneys at Legal Aid Services of Oklahoma Tulsa Law Office and social workers embedded within the OU-Tulsa clinics. Amy Hendrix is an academic research assistant in the Department of Pediatrics at the OU-Tulsa School of Community Medicine. Her research focuses include child maltreatment and social detriments of health. She helped with the development of Dr. Baxter's compassion fatigue program, along with the study evaluating it. She currently oversees the periodic assessment of participants in the program. She has presented at the local and national level regarding the impact of STS on professionals that are exposed to it. And she has also previously led courses for staff and attorneys at Legal Aid Services of Oklahoma's Tulsa Law Office and social workers embedded within the OU-Tulsa clinics. Each of our presenters today has personally experienced the impact of vicarious trauma, secondary traumatic stress, burnout, and compassion fatigue. These experiences have led each of them to be passionate about raising awareness regarding the occurrences of these issues while offering practical advice that individuals can use to mitigate their effects. Let me turn it over to you.
Thank you so much for that introduction. I'm really excited to be here. I was actually an RSU alumni. I finished a 4-year degree and then actually worked at RSU before coming over to OU. So it's really great to virtually be back on the Hill and talking about something that's very near and dear to my heart. There we go. So for disclosures, we don't have any conflicts of interest to disclose regarding this presentation today. And then we just kind of briefly wanted to talk about the objectives. So the first thing that we're going to do is we're really going to talk about the elephant that's kind of in the room right now, which is the unique stressors that people are experiencing during the COVID-19 pandemic and how that kind of really impacts caregivers. We're also going to help participants be able to differentiate between secondary trauma, vicarious trauma, burnout, and compassion fatigue, because those terms are pretty nebulous and can get kind of confusing. Also, we're going to talk about formulating your own wellness plan. So being able to identify when these things are affecting you and being able to have a plan in place to make sure that you're taking care of yourself while you're taking care of others. And then finally, we're going to be kind of just discussing, we have about a 28-ish page resource handout that we'll be providing to everyone, just full of local, regional, and federal resources, depending upon maybe the types of unique needs that you might experience during COVID-19 or even after the pandemic. So now on to the real disclosure, which is all three of us have experienced secondary trauma every day in our work. The effects of that trauma do not stop when we leave work and go home. So this is something that the three of us have experienced, something that, you know, through the work that we're doing currently has been able to really help us. And that's why we're here today, is to be able to share this information, and hopefully it will benefit you the same way that it's benefited us. So this is my own story as a caregiver. Anyone that knows me personally knows that I lost my mom a few years ago. We will be discussing kind of some of our traumatic stories, not so much the deep-rooted trauma, but just to show that, we understand the impacts from a personal level. My mom actually worked at the Department of Pediatrics in OU and left a legacy behind for me that I was able to kind of pick up and run with when I was able to start my job over at OU. I, at the age of, late 20s, was not anticipating losing someone so near and dear to me, and someone who had really been a primary caregiver and, advice giver to me my entire life. Suddenly the tables had kind of turned and I was taking care of my mom, something that I knew would happen eventually, as we all do, but I had certainly not anticipated it happening anytime soon. So a lot of what we're talking about today, I really geared towards not only parents, but any caregiver, those of us that might find ourselves with a terminally ill parent or an aging parent. So really, when we're talking about caregivers, it's really any person or professional that helps or provides assistance or care to others. This talk is unique because I feel like it translates to just about everyone. I haven't had a single person sit through one of these presentations and say that they haven't taken something away from it. So hopefully you will be able to use some of this information. So first, the thing that I just kind of want to talk about, and this kind of gives you an overview of some of the things that we're going to kind of deep dive into, is kind of the spectrum of all these things and how they relate to one another and what they are. So when we talk about primary trauma, we're thinking about those real, primary events. So you're a first responder and you arrive to the scene of a car crash, or, you're out and about and you see someone assaulted or maybe something like that. Now, when you start getting into secondary trauma, it's that we don't personally actually experience that trauma. We're not there when the event is taking place, but maybe we're hearing about it or we're reading about it. You open the news lately and there's no good stories, right? We're hearing about all of these terrible things that are happening. And so those things actually can impact us as we're hearing them on the day-to-day. This is particularly important for people like social workers, counselors, child abuse pediatricians. But I even found myself experiencing secondary trauma as a researcher dealing with child abuse data, just because I was being exposed to traumatic content repeatedly that I had not previously had to really consider or deal with. And those things kind of drive into what we call this trifecta. And it's really important to know every researcher has kind of a different layout on how these things happen. But in our experiences, these are really the methods or the pathway that makes the most sense to us. So when you start experiencing secondary trauma, you're going to start experiencing things like vicarious trauma, which transforms our worldview due to this repeated exposure of these traumatic images or stories. And this also happens because of the repeated secondary traumatic stress that we might be feeling over time. You're also going to develop what we call compassion fatigue. So that's just emotional and physical exhaustion that limits a person's ability to regenerate. So suddenly you're just not able to provide the care maybe that you've been able to in the past because you've just kind of hit this wall. And that's another important thing that we'll be discussing today. And finally, all those things lead to burnout, which I think is the thing that most people are probably the most familiar with because it's really started to make its way into kind of the mainstream media. But that's the stress and frustration caused typically by a workplace, but certainly you could feel it within your personal life as well. So the first thing that I want to do now that we've kind of talked about this grand overview is talking about what we've experienced during COVID-19, how it's impacted us, how it's disrupted us. And so this is actually a really important slide for those of you that are kind of like in the social work field, or maybe you're going into the counseling field. It's going to look kind of familiar. It's Urie Bronfenbrenner's ecological systems theory, but it's actually kind of looked at through a COVID lens. And so this theory purports that it's one of the most accepted explanations regarding the influence of social environments on human development. And it argues that the environment you grow up in affects every facet of your life. Social factors determine your way of thinking, the emotions you feel, and your likes and dislikes. What I found is, even though primarily this is talking about development, it's still relatable for those of us that are experiencing these different systems. So within COVID-19, kind of when this happened, you start to see these different circles become disrupted. So for social cultural norms, all of a sudden there was a stigma against certain ethnic groups that unfortunately kind of proliferated and is still being maintained in certain areas. On the society side, you have the erosion of social capita. So all of a sudden we're being told, you know, we need to social distance. And so maybe we're not getting to see and kind of participate in those social networks that provided support for us. And then we also have disruption or limited access to basic services, which is obviously really causing a lot of people to be in a bind. On the community side, you have the breakdown of trust, competition over scarce resources. I know any of you that live in Claremore know that in March and April, trying to find toilet paper was like the adventure of a lifetime, right? Like for some reason, there was a huge run on toilet paper and no one could find it. Limited access to community support services is another issue. And then, you know, really not being able to have those same educational and play spaces that we were used to our kids being able to have access to. On the family system side of things, you have family separation, reduced access to social support, caregiver distress. Suddenly, you know, mom and dad might be working from home and kiddo is doing virtual schooling, and suddenly we're trying to work and also make sure that our kid is doing their assignments that they're supposed to be doing. There's also unfortunately been a heightened risk of violence and domestic abuse that we've seen, and there's been a lot of concerns about it as the pandemic has progressed. And then obviously the disruption to livelihood, disrupted family connections and support, and just fear of the disease. It's certainly a scary time when you hear these stories. And then all of those things kind of come back for those of us that have kiddos in our homes. There's a heightened risk for child abuse, neglect, violence, exploitation, psychological distress, and negative impact on development. And it's, you know, for a long time, I feel like early in the pandemic, it was, well, this is a big city problem, right? This we don't need to worry about it. It's in New York, it's in California, but it's not going to come to Oklahoma. And then it came to Oklahoma. Well, it's going to stay in Tulsa and Oklahoma City. It's not going to affect us, you know, here in small towns. And so what you see here are some stories, a lot of which are actually from the Claremore area. One research article in which I, with some colleagues at OU, looked at some disparities in Oklahoma related to COVID. So this is a widespread problem at this point. I think that we can all probably agree with that. And it is causing a level of stress and distress for many caregivers, many families, and many individuals. So when we talk about the healthcare cost, you know, where are things, what are we doing? As of this morning, we had over 100,000, so 164,340 cases. And those are individuals that have gotten COVID. Within that, we had 1,588 deaths. Within the next few days, we will be at 10 times the number of deaths related to COVID than basically the people that died in the Oklahoma City bombing, just for comparison. And there's a lot of uncertainties that remain regarding the long-term health implications of the virus, which obviously causes a lot of stress for many of us. And then caregiving professionals such as healthcare workers are experiencing increased levels of burnout and compassion fatigue. There was a doctor the other day on the news from Lawton that broke down in tears when he was being interviewed. Everyone is really at their breaking point at this point. But we also need to talk about the human toll. So it's not just the cases, it's not just the deaths. What else is happening? There's increased financial burdens for families, increased demand on caregivers, risk for domestic violence and child maltreatment like we were talking about, and just a lot of stress. Everyone that I talk to, regardless of what they do, if they have kids or they're taking care of parents, or maybe it's just them, everyone is stressed out. And we also, like I said, have that decreased social support. We're not able to really go out and see our friends without having to worry, are we sick and we're going to spread this to them. and not having those access to support services and resources like we usually would have. So there was a study that was done by Blue Cross and Blue Shield. It was the Archangel study, and they actually went out and they surveyed a bunch of caregivers as it relates to COVID, and they just asked them kind of, what's going on? How are you feeling? How is this impacting you? And 61% of Americans are worrying about taking care or looking out for a friend, a neighbor, or a family member due to COVID-19. I mean, I know, like, for instance, a lot of my neighbors are elderly. That's certainly something that I worry about if they live on their own, of, who's going to help them? Are they doing okay? And what can we do for them as a community? 55% of current caregivers would not have identified as a caregiver before the COVID-19 pandemic. So all of a sudden, we're seeing this dramatic shift over, the span of a few months of people that are now having to take on this new role on top of the other things that they may have been having to do before the pandemic. And then caregivers reported high rates of COVID-19 related loneliness or isolation. 55% of millennials, 54% of Gen Xers, and 42% of baby boomers. And I feel like that's important as well. One of the notes that I, would be remiss to not note, early on in the pandemic, we kind of coined this idea of social distancing, because that is one of the key factors that we have to really mitigate disease spread. But we need to kind of re-gear that and think about its physical distancing. We still need to find ways to have those social connections. Maybe it's over Zoom, maybe it's a phone call, maybe it's writing a letter, but finding ways to reconnect with people safely to make sure that we have those support systems still. And with that, I am actually going to turn it over to Dr. Baxter, who's really going to deep dive into some of these specific issues and what the symptoms are like. And then we're going to talk about what we can do to mitigate them.
So, thank you, Amy, so much. And just to the RSU crowd, I would just say that Amy coming out of your program and what she's done for our program here has been amazing. Our scholarly activity and the amount of research we've been able to do in our output for my team has just risen so dramatically. So I just want to thank you all for training her and helping us with our program here. I had to say that so I could see her get embarrassed on the Zoom. So yeah, we'll dive into some of these terms and just to kind of explore a little bit of the history of where they come from and how we use them. So just as a background, my interest in secondary traumatic stress came from my experience as a child abuse pediatrician running the team for children at risk in 2015, and seeing that there was only two faculty at the time, myself and my colleague, Dr. Passmore, and we were just kind of experiencing these feelings and just having a lot of problems with our team. And I met a Jesuit priest from Camden, New Jersey, who introduced me to the concept of secondary traumatic stress and how it impacted a nonprofit that he ran and how it nearly destroyed his team and how they had done some of these trainings over the past few years. So I started kind of diving into it and ended up being able to present at some national conferences and just listening to some national experts on it. So just my disclaimer is that I am not a psychologist or psychiatrist or anyone who has done a lot of maybe extensive training in this, but I have learned a lot about it and have been able to teach others a little bit from my personal experience with it. So I first went to the National Child Traumatic Stress Network, and this is the definition I like to use, and because it kind of explains how it feels for me. But I define secondary traumatic stress as the emotional duress that results when an individual hears about the firsthand trauma experiences of another person. So it's not you experiencing that primary trauma, but it is you helping someone who has had that primary trauma and kind of how it impacts you and your view. Other authors or researchers such as Figling and Cleaver defined it as when one is exposed to extreme events directly experienced by another person. So in their theory, they were unable to conclusively demonstrate the mechanism that accounts for this transmission of traumatic stress from one individual to another. But there was a hypothesis that a caregiver's level of empathy with the traumatized individual does play a significant role in the transmission. And then when you have those combined effects of the caregivers continuously visualization of these clients through either traumatic images or stories kind of add to the effects. And this is all related to compassion, stress, or compassion fatigue and burnout. So what does it feel like? I think that's an easier way to kind of conceptualize this rather than just knowing the definition. So just on an individual level, on a personal level, most of the symptoms mimic those for post-traumatic stress disorder. So oftentimes individuals will feel very hypervigilant. They will have intrusive thoughts. So maybe after your workday is completed or your caregiving experience is completed, you'll have thoughts of everything kind of coming in. My big thing that I know when I'm experiencing this is avoiding reminders of past clients. So if you've had an experience with the past clients, you'll kind of avoid any sort of reminder of that feeling of just feeling numb or somewhat detached. And then you actually can have physical issues, such as just you kind of feel chronically exhausted, or even just like a sense of your muscles hurting, are all things that you can experience. And then if you run a team, your staff can experience these symptoms as well. And if you start seeing them being very short-tempered with clients or individuals who are coming into your facility, or people that they're in charge of the care of, and they may kind of respond in ways that to others that should just kind of be like a rather benign response. Or if you start noticing your staff or other people you're working with, just kind of avoiding situations, avoiding calls, avoid returning emails or text messages, and just kind of avoiding the whole situation because of how they are feeling. So when we look at the literature for who's at risk for this, it really does run the gamut. Most of the literature has been on how this has impacted initially psychologists, or people who do therapy, grief counseling, trauma therapy, and how their clients have impacted them. But really, it's kind of exploded to where, for me personally, in the medical field, we know that this impacts all the way from the front desk staff to the attending physician. So nursing staff is impacted as well. And then for someone who's a clinical educator and educates all the way from pre-med students to third-year fellows, so someone who's gone through all their training, I know that it impacts them as well. So supervisors kind of get a double impact, particularly if you're in a supervisory role like I am, where you're both seeing this, a client, but then you're also in charge of supervising others and maybe debriefing with them and staffing with them, and then hearing about their trauma that they've experienced as well. I think during this time, it's really important, as Ms. Hendrix kind of mentioned, with COVID and thinking about our essential workers, so people who are working in grocery stores and food service industries, and how this is impacting them as well. Drivers are hearing this, maintenance workers, so having someone come in and you're on the phone about something that can impact them as well. So I think those are all really, it's really just key to understand how this kind of runs the gamut on who it impacts. Risk factors for you personally. So if you, we know that helpers have often chosen to go into the helping profession because they may have their own history of trauma or their own experience, and this is a way that they feel like that they want to kind of help work it out. So while these experiences can be a source of strength and kind of give you a reason to go and do this, it can also provide that more empathetic connection with others, and that they can make people feel more vulnerable to developing secondary traumatic stress. And other research there has been research showing that about 60% of helping professionals have trauma history of their own. So if you have that, you identify with a victim. For me, when I'm seeing children with suspected child maltreatment that are at or near my own child's age, or even sharing the same name, or just kind of physically resemble my child, I really, those cases, I kind of, I take those home with me a little bit more. Another example would be one of my colleagues who had twins, and one of the first cases we had when she came back from maternity leave was a really severe case of twins. And so it was one of those things where I just kept her from being exposed to that, so she didn't have to hear those stories. And then if you just don't have it within your own personal social support, if you just have low social support, or if you just have a lot of negative personal circumstances, which again, I would argue with COVID-19, we're all kind of in that with having that normal support system we have not being there in those negative personal circumstances, particularly given the economic stress that COVID-19 has put on all of us, are all risk factors that we can see. Work-related risk factors. Sorry, Amy, I'm sorry. I should have been saying next slide. I've been doing it in my head. You've been doing really well to keep up with me. This is why Amy is so amazing, is she more or less reads my mind when I'm doing this stuff. So work-related risk factors. So those we know with individuals who are inexperienced, and this is for me why I want to focus on medical students and letting them know about this all the way through my interns and residents. And so same thing for y'all within your field. If you have someone who just doesn't have a lot of experience and you know that they're going to be exposed to secondary traumatic stress, just really kind of working with them. Individuals who don't have supervision. So if this is someone who you are training to do a job similar to yours, they need that supervision and that feedback and being able to debrief. If you are just kind of thrown out there by yourself, individuals like that tend to experience secondary traumatic stress and some of the other components of this as well. And then if you just have a high frequency, so I think about my colleagues in emergency rooms and ICUs, particularly right now during COVID, where it's just constantly having a lot of trauma day in and day out. So if it's something that only happens once every 6 months, you're able to typically adjust to that a lot better than if it's happening, every hour or every day. And then when you have a critical incident, so if it is a really severe traumatic experience for the team that they're hearing about it, that can impact them as well. So the reason we focus on talking about secondary traumatic stress is kind of what we alluded to earlier, is this really does lead to the development of vicarious trauma in individuals. So I want to just kind of dive into vicarious trauma a bit. Next slide. So how I view vicarious trauma, and the definitions up there, is this is really something where because of the trauma you've experienced, whether it's primary trauma or secondary trauma, your worldview then changes. And so it's that traumatic stress and how you now observe the world, and how you kind of maybe could put that out back into the world. So people who experience vicarious trauma can feel more negative and pessimistic. They can feel hopeless about any possibility for change, and also just really overwhelmed by any obstacles. And then they may project some of their trauma or their work experiences onto others. So for me, an example that I give is when I am trying to practice wellness and running through the park, and I look over and I see an individual with a young child. I start projecting any things on them, like, is that the person she's supposed to be with? Is something going on? And more than likely, this is just a little girl with her grandfather or with her dad. But I just kind of start projecting those. Other examples have been when you hear, like at the grocery store, and you hear people fighting in the aisle, or you hear someone yelling at a child next to you, that people will kind of project what's going on with that. And so staff with vicarious trauma must deal with these effects on their personal lives and relationships. And these challenges can be really hard to reverse. So for me, this is one example I give as well. So sorry, next slide. This is one example I give as well, is that I grew up jumping on trampoline. I actually saved up my money to have one. But now as a pediatrician, when I see this, I immediately think of childhood injuries, from leg fractures to head injuries. So when I see a kid on a trampoline now, like, I just start picturing all these children that I've seen in the past. So I think if we can, I don't know if we can actually have a discussion within the chat on this, but if anyone can throw out some examples of way they think that vicarious trauma has impacted them, and things that should be fairly innocuous for most people, but something that you may, when you see, kind of what you start thinking when you see that. So I'll give everyone a few minutes to kind of do that. So Amy, I'm not sure if you're able to monitor that, but if you want to chime in on anything.
I am. No one has commented yet, but I will say, as not a physician, but everyone that personally knows me, a very clumsy and human being. All I see are either the injuries that I gave myself while being on a trampoline, or the ones I gave my brother being on a trampoline. And you know, Matthew, if you're listening, I'm sure that you would agree with that sentiment.
Yeah. So if anyone does put anything in there, we'll kind of come back to that later. If just to kind of bring it back up. Next slide. Oh, I think that's kind of the same thing. Oh yeah, so on this, if there's anything in the discussion on what do you see when you see this type of graphic, what are you thinking of? I know immediately where Amy's going with this. So for me, what I see with this is someone coughing and spreading COVID everywhere because they don't have a mask, and suddenly people becoming infected and people quarantined and getting tests. So that's what I'm seeing with this, and that's probably related to just me having seen knowing that how much COVID-19 is prevalent right now. So we'll move on to the next slide. So one other thing that we have found that has been helpful, and this is from a textbook that we used, or a workbook that we used when doing some of these courses, is just kind of doing a trauma narrative exercise. And April's putting it up right now. I don't know if anyone can see that, but it's Compassion Fatigue Workbook. So just take a few minutes and look at the questions that are on there, and then just write down a few things, or just kind of think about how would you tell the story of the work or the caregiving you have done, and then how do you start noticing that work has had an impact on you. So these are exercises you can do now, or just take a screenshot and use this in the future. I use this with my residents just to kind of make them refocus on why they're doing the work they're doing and how it's impacting them. And oftentimes, particularly if you're just doing this in a small group with others who have a shared experience, it kind of just provides an opening for discussion on secondary traumatic stress, and it's just kind of helpful. So just doing that trauma narrative and kind of writing it out oftentimes is a nice way to start maybe a formal debriefing, or just a way to kind of share those experiences with your team. If there's anything in the discussion, we can bring it up. Otherwise, I'm good moving on to the next slide.
So Caitlin asked, do you have to answer these publicly? And absolutely not. So this is something that you can very much do on your own time. Actually, the resource handout that we're giving you guys will have all of these in a Word document. So it's something that you can take and do on your own time and share with others too.
Right, I agree. And I even say that if you're doing this as a formal debriefing with the small group, the rules should be set so that people aren't forced to share or talk about anything, but just give them the opportunity. So oftentimes some people will just write down 1 or 2 sentences, and then I always give everyone the opportunity to share if they wish, but never have anyone actually do it. But I will say my experience has been sometimes people will go away from that meeting or away from that training and then contact me and say, hey, so I wrote this down and just kind of wanted to talk about it. And I think sometimes it just takes people a while to kind of process those questions and move on. So exactly. So yeah, we can move on and talk a little bit about compassion fatigue. So next slide. So I think this is the big thing, and is the initial diagram kind of showed, is the reason we need to be aware of secondary traumatic stress and vicarious trauma is I tell my learners when they come in that the most difficult patient I see each day or each week is always the last one. And what I mean by that is it's not always technically the most medically difficult or medically complex. But for me, just to be able to walk in there and give that child and that family the same attentiveness that I gave maybe the first patient of the day or the first patient I saw that week when my tank was kind of full, because I'm just fatigued emotionally. But that child, that family, or those clients, the people you're providing care for, deserve that same level from you. However, because of compassion fatigue, which is basically that cost that we have for providing others our care, we just do kind of feel drained. And it's a big contributing factor in developing burnout. And this is also sometimes that you can actually feel physical and emotional symptoms. So I've had individuals describe, that they just physically feel sore. Their bodies are just sore, either at the end of the day, if they've had a very stressful day, or if they've been experiencing a lot of other people's trauma. Next slide. So similar symptoms to this that people have. Again, the avoidance of meetings, I think, is a big one, and just kind of feeling angry and irritable. So one thing for me, I know that this is one of my signs that I will tend to avoid simple things that aren't really that difficult, like my faculty meetings. I just don't want to sign on because it's during the lunch hour and I just don't want to do that. Or in 2015, I was basically missing most of our grand rounds, which is an educational seminar that we have that, I'm not even the one presenting, I just have to listen, but I would just avoid those. And then you also tend to see avoidance of returning phone calls to clients, or just kind of following up on some of the things that you have. Other aspects would be when you are talking to a client or talking to someone you're supposed to caregive, and you should be asking certain questions that are going to help them. But because those questions may remind you of a recent traumatic experience with another client or within yourself, you just avoid asking them. And for me, in the medical field, that can be really dangerous because you may need to ask certain people certain things to make sure you're keeping them safe or keeping others safe from them. And then the whole feeling discouraged. Here in Oklahoma, this is definitely something I experienced with lack of resources for the children I'm seeing and the families I'm seeing, that I, particularly with COVID, one thing I recommend on virtually every child that I see in family is therapy, or like a trauma-focused therapy. And with COVID right now, the therapists are just overwhelmed, or they're doing it from home, which is not a great way to establish with a new client. And then at the end of the day, just feeling that kind of fatigue. And this is something I've learned to cope with myself. We'll talk about some different coping mechanisms for it, or some different techniques, but my wife knows if I've had a difficult day, when I get home, sometimes I just take 15 minutes and I kind of do a deep breathing exercise. She calls it I'm recharging, and that's kind of a way to think about it. But I just do a deep breathing exercise and almost go into a brief light sleep, and then I'm up better and feeling better, and I'm able to kind of go on and move through my day. Next slide. And just to kind of close with, all of these will kind of go to and lead to burnout. And this is what we want to avoid, and what we hope to help with here is burnout is really where we don't want anyone to be, because this is really where you're done. As the definition shows, that emotional exhaustion, loss of meaning of work, ineffectiveness, and a tendency to objectify people, just view them as objects. And this has really profound implications for trauma workers, and their families. So in addition, burnout can impact the quality of care that we provide, and turnover, which can impact costs to your organization by having constant turnover. So things like emotional exhaustion, which is just that tiredness, those somatic symptoms, the decreased emotional resources, and a feeling that you just have nothing left to give, is what people will describe this as. And they just have a state of a feeling of emotionally overextended and exhausted by their work. Other depersonalization is, again, that negative, cynical attitudes, referring to clients or individuals not by their name, but just assigning like their disease process to them, or just as an object. So this is something with my learners we also talk about. we have to, for privacy reasons, not say children's names out loud. So we'll say the kid in room 105. And that's okay if you are trying to maintain privacy. But what I try to do with my learners is I use the child's name when we're talking about them. And I will refer to them in that way if it's in a setting that's private and I can maintain their privacy. Other things would just be reduced personal accomplishment, and you just kind of feel incompetent, inefficient, and inadequate. And those are all symptoms of burnout. Next slide. So it impacts caregivers through just exposure to severe and chronic stressors. And this may predispose helpers to a variety of mental morbidities and dysfunctions. So concern for things like depression, anxiety, sleep disturbances, and fatigue are all there. It can also impact your relationships. Individuals who are experiencing burnout may be using alcohol or drugs as an escape, so it can have some addiction problems as well as problems within your marital or your relationship can have some dysfunction. And then also people will often leave their work or retire from work early, again, limiting the amount of care they're able to provide. And then one of the most serious aspects of this, and something we've seen within the medical community, is the risk of suicide. And so those helping professions in the medical community that have the highest rates of burnout also have the highest rates of physician and healthcare provider suicide. So those who are experiencing burnout are reported to be at greater risk of making poor judgment, including errors in their work, just kind of disengaging from work. They may be hostile towards clients, and then just have a difficulty working with other coworkers. Next slide. So some of the risk factors would be just having a negative work environment or a home environment, particularly for those working from home right now. So if you don't have that support system within your organization, that can cause problems. If you don't have individual satisfaction with your job, that can cause issues as well. And then when we have work environments that lead to things like excessive workload, long work hours, fatigue, and decreased emotional interactions, again, something I think people are experiencing with COVID-19, and then just the cognitive demands or the thought demands from your job or your practice can impact it. And then individuals who are just really restricted. So if their supervisors are restricting their autonomy, this can all impact them as well. And it can increase the risk for burnout. So certain other demographic factors. So again, young age, the literature shows female gender are at higher risk. Not having a support person or a marital status or a partner is a risk. It is a risk factor for burnout, and then just working longer hours and without a lot of job satisfaction. Next slide. So the one thing I hope that we can share with you, and what we'll kind of be transitioning to, is not everything is doom and gloom. We want you to understand these terms so that you can assign words to the feelings you may be experiencing or that others may be experiencing. But the good thing is we do know that there are ways to combat that. And one thing I do want to focus on is that we experience compassion satisfaction as well. So while you experience all that, what refills our tank or what refills our battery are these satisfaction type experiences. And so this is just that feeling, that pleasure that you derive from being able to do your work. So I give an example of, even when I see really traumatic cases with my work, I typically try to take one thing out that provides that satisfaction. So I have a slide when I present that is these drawings that these 3 girls did that had been in a really horrible situation, and our team intervened and got them into a safe place. And while they were kind of waiting for some of this to settle out, they went in on our board and wrote thank you and drew superheroes and all over the place. And our team didn't know that they did this. And when we came in for our team meeting the following morning, we saw that on our whiteboard, and everyone just kind of, their tanks were a little bit refilled, and that's something that you can experience. Next slide. So one way to do this is just to reconnect with your work, the rewards from your work. And so again, there's 7 additional questions here that I think are helpful to go through. And this is something else you can do as kind of an exercise just quickly now or just kind of save and do in the future. Again, not something that you have to share. But it goes through each of these questions. And I think that the last one, number 7, is always really important to kind of talk about is this still the right job for me? And just to kind of reassess that and make sure that you are still in a place where you are being provided those rewards from your work. And if not, looking at maybe other options where you can find those pleasures or rewards again. And with that, I'm going to turn it back over to Ms. Hendrix.
So I had to some way throw in a Kurt Vonnegut quote for everyone. And I feel like this quote actually resonates quite well with kind of the concept of compassion, satisfaction. He wrote, "I urge you to please notice when you are happy and exclaim or murmur or think at some point, if this isn't nice, I don't know what is." And I feel like that really gets to the point, those really tough days where all we want to do at the end of the day is go to bed. But you gotta cook for the family, or maybe your kiddo's coming in and saying, "I need you to read me one more bedtime story, mommy," or daddy, one more. But then, they have those moments where someone thanks you, or your kiddo tells you, "I love you," or "I don't know what I would do without you," right? Those small moments where maybe we had just kind of been in a dark place, but something happens. It's a little spark that reminds us of why we're doing what we're doing, and it helps us keep moving forward. And so I think that that's really important. And I think that the concept of having that to kind of feed our soul and to remain hopeful is really important to be able to get through COVID in particular. I am going to transition us to, I'm going to talk about a few things and I'm going to hand it over to April. So we definitely didn't want to just be like, and here's all the bad things, so the bad things, and then not give you anything that could actually help you kind of address these issues, because we all experience them. So the first thing that you really want to look at is, what's been found to help reduce compassion fatigue. So one of the biggest things is strong social support, both at home and at work. We're very social beings. It's vital that we have that support, that we have people that we can talk to after a difficult day or a difficult week that will listen. Increase self-awareness. So this was a big one for me. While teaching these classes, I was able to start identifying when I was experiencing compassion fatigue, so I could pump the brakes, step back and say, what's going on? And let's go down a different path and not down this path to burnout. Good self-care. So as caregivers, I think that for whatever reason, our society has made it a noble cause to martyr ourselves. And I am 100% guilty of, digging myself into a hole because I want to be able to help everyone and I want to keep doing. What I have realized personally is that actually does not suit me, and it doesn't suit the people that I'm trying to help or advocate for. So being able to have that reflection and know that we need to take care of ourselves. Better work-life balance. I think all of us are still working on this. I feel like with COVID, a lot of us working at home or having new restrictions, this is a new balancing act, and it's very fluid and kind of new territory for us. Job satisfaction is very important. When you can, rebalancing caseloads and workload reduction. So this is really important specifically for supervisors, because, if you're not a supervisor, you can't always just say, well, I'm not taking this case, or I'm not doing this work, right? Like your supervisor is probably not going to respond well to that. So having those meaningful conversations institutionally, or maybe even within your home, if you have a partner that you really need help from them to be able to lessen some of the load that you're having on caregiving. Limiting our trauma inputs. I cannot tell you how important it is. Every time I get on Facebook, there's a new term called doom scrolling, right? Like it is bad news after bad news and everyone's yelling at each other and it's terrible. We need to take a step back, maintain social connections, but also realize that we don't need to put ourselves through this 24/7. There is a point of staying informed and staying connected with what's happening in the world. And then there's a point where we're just doing harm to ourselves. And we really need to work on making sure that we're informed, but also taking care of ourselves at the same time. Accessing coaching, counseling, and good supervision as needed. I feel like, there was always a lot of stigma around going to therapy. And my hope is what I'm at least seeing with people my age is people are really starting to openly discuss when they're going to therapy now. It's not something that a lot of people hide anymore. And so we need to start really from supervisors, individuals, family units, everyone, encourage people to reach out to these resources because there's nothing wrong with getting help. And then attending regular professional development and ongoing training for professionals is just essential, right? Like we need to be able to know what's going on. We need to be up to date with our information, just to also not be have additional stress. And then just these two important principles for staying afloat. So the first one is the development and maintenance of intentionality through a non-anxious presence in both personal and professional spheres in life. I'll tell you, I'm still working on this. Anyone that knows me personally knows that I am an incredibly anxious person. So this has been something that's been a little difficult, but there's that intentionality, right? So being able to even notice when I'm becoming anxious and taking a step back and saying, what can I do personally within my brain to mitigate these things. And the development of maintenance of self-validation, especially in self-validated caregiving. So I cannot tell you how long it took me to find a picture of the Nickelodeon slime that I liked, but I felt like this was a perfect representation of this. And so we talk a lot, those of us that work in trauma fields, about sliming. So sliming is basically sharing the graphic or traumatic content that you've heard or experienced with others. You're basically spreading vicarious trauma to others and can perpetuate a climate of cynicism and hopelessness. So there have been times where I have been at the advocacy center and like a police officer or a social worker will walk in and they'll need to be debriefing a case with Dr. Baxter, and he will immediately just politely stop them and say, Ms. Hendrix is here for research purposes, like she does not need to be traumatized with this. And that's kind of really helped me kind of shape the way that I think and the way that I interact with people if they start kind of, I also call it trauma vomiting on someone, to kind of get them to stop that. It's really important. And it's not just for professionals. I feel like sometimes human beings, for whatever reason, we're really drawn to negative stories. And so like at family gatherings, maybe don't share all the terrible things that you've heard on the news, right? Like maybe focus on the present and the positive. It's not necessarily a bad thing to do. And then anyone that also knows me knows that I'm a huge Office fan, and I felt like, sliming and just all of this really relates perfectly back to Michael Scott's character. Where he just says, sometimes I'll start a sentence and I don't even know where it's going, right? So that goes back to that intentionality and self-awareness. We need to be aware of the things that we're doing so we're not unintentionally traumatizing people. When we need to talk to someone about something traumatic, we need to give them a fair warning. We need to hear from them that they are okay with hearing that. And then also, they don't need every gory detail, right? A lot of times we can tell a story pretty succinctly without every graphic detail. And with that, I am going to hand it over to April, and she's going to talk about some awesome strategies that we can implement in our lives to help combat these issues.
Of course, I forget the mute button. Okay, so thank you, Amy, and thank you, Dr. Baxter, for setting this up for me. I feel like you guys done so great. So I want to talk a little bit about an early warning system and really learning to, back to that self-awareness that Amy was talking about, learning to recognize one's own symptoms of compassion fatigue, and also knowing when you're moving into that like, caution zone, yellow light, like I was green light, we were doing great, plugging along, like, okay, now I'm in the yellow light area. And for me, one of the physical reminders, and Dr. Baxter and Amy have heard me say this a million times, is I start noticing, I'll be typing on my computer and I'll notice, there go my shoulders. Okay, my shoulders are really tense. And sometimes it'll take me hours and then I'll realize like, oh man, my shoulders and neck feel really tense. And that is sort of my physical symptom, like, okay, I'm creeping up to that yellow zone. I need to like check out what's going on in my life. Like, what do I need to work on? And so just being aware of that and kind of identifying those telltale signs for yourself, because everybody is a little different. So not everybody's going to be at their keyboard and be like, oh, my shoulders are super tight. That's just my own warning sign. But just really starting to observe when you see yourself getting into a situation where you're not like, you're kind of losing passion for your work, you're having a hard time paying attention, a lot of those signs and symptoms that Amy and Dr. Baxter already covered. And so when I get to the red zone, that's when I take a couple days off work. Okay, next slide, please. So this is how, these are just some questions, and you don't have to answer these now. You can answer them after after this presentation, but just how to develop your own early warning system so that you can observe those things, those signs and symptoms that really stand out for you, or that you can start to notice, and then sort of coming up with a plan for, okay, so what do I do at that point? And I actually had a conversation, I heard a podcast a couple of weeks ago now, where the person was asking all these experts, and I think Tara Brosh was the expert that she was asking about self-care. And she said something like, I don't call it self-care anymore, because there's this connotation that like with self-care, you have to drink 8 glasses of water, and you have to run 2 miles, and you have to eat a fully balanced meal, and you have to sleep 8 hours a day, and you have to like all of these things, and it just adds more stress to your plate. It's just more things on your to-do list. She said, I stopped calling it self-care for that reason, and then for the other reason that people think it's selfish because of that self-care word. And so she started calling it soul care, because as a human being, there are things that we have to care for our souls, like who we are at our core. And I thought that captured my experience with self-care so much better than, you know, getting a manicure or a pedicure, which that could be part of your self-care, your soul or self-care plan. But that's not all, right? It's really about nurturing who you are and getting yourself in a healthy place so you can do your best work. So anyway, you guys can you can go through those questions at a later time. Next slide, please. And so this next slide is about developing a compassion fatigue protection toolkit. So this is really like looking at those warning signs and then what to do about them. So what are some things, how can I cope with those? So once I get up to that yellow zone, like I was telling you guys about earlier, I know that I need to go and garden for a little bit. I need to get outside, go for a walk with my kiddo, just get outside. There's something about being in nature that really helps me, grounds me, brings me back to a healthier place, a healthier mindset. But you can see that there's lots of things that you could do. What are the things you have control over? What are the things you don't have control over? What are stress relief strategies I enjoy? What works for me? And I encourage you to work on that for yourself and figure out what works best for you. Really think about it. Some of the things I didn't even consider, like I didn't even think that I just garden for fun. I didn't think like, oh wait, this is actually part of my soul care plan. This actually makes me feel a lot better about life. Oh, sorry. Next slide, please. Okay, so now we're going to go through the basic self-care plan that was in our textbook, and this is linked in the resources, but I think it's you can find it in the resources, but this is the text that we worked through. And so I'm just going to take you through very quickly the 4 steps. Next slide, please. And so you can see them, and then we'll go through each step in order. So step 1 is just taking stock, and that's kind of like, where are we right now? What's the baseline? Step 2 is enhancing self-care or soul care and that work-life balance. Step 3 is developing resiliency skills. what really helps you bounce back is what we're looking for. Step 4 is making a commitment to change. Next slide, please. So in step 1, really taking stock of what are those things that are on your plate that you're dealing with day in and day out at home and at work that are stressing you. As an attorney, I have to account for my time in 10-minute increments. And that is an incredibly stressful thing for me. I feel like it's such a waste of my time to do that because it takes so much time to do that. And so that was definitely like one of the things that I wrote on there. It's something that's required. I have to do it. I do it, but it's just a stressful thing. So I worked my daily schedule so that that's something that I do right before I leave for lunch. So like my reward is I get to go leave for lunch and I get that knocked out. And then if I bake it in that way and it's not like, oh man, I've got to do this right before I leave for home, it really creates a better situation for me when I'm going home. I'm in a better mindset. Track your physical well-being. You can find a ton of versions of this, full body scan exercises. I think there's an app called the Insight Timer, and they have a ton of free full body scans and meditations on there that I really like. There's a particular one called A Body Scan by Tara Brosh, which I think is a really good one, but a lot of them are great. So track and limit your trauma inputs both at home and at work. As Amy talked about before, like watching the news. I used to watch the news and read the newspaper every single day. And I consider myself, like a pretty informed person. But I found that doing those things was not beneficial to my mental health all the time. And so I actually have, news breaks, and I will just go for a period of time where I won't watch any news, listen to news. I won't have NPR going in my car like I usually do. I'll just put on, the radio or put on Spotify or something. And then ask yourself what it would take for you to make serious changes to your schedule and your self or soul care routine. Next slide, please. So the work-life balance. So having control over your schedule is so helpful. Even if you don't have complete control over your schedule, if there are portions of your time that you do have control over, really focusing on being intentional with how you spend that time to support your own well-being is really key. And you guys can read through this, like, working from home, although now with the pandemic, it's maybe not so great. But just having a change of scenery can sometimes be really helpful. One of the things that I really struggled with is after my maternity leave for my child, I went straight back to full-time work. And it was very difficult for me to go from full-time caregiving to full-time work. And I felt like I didn't really have an opportunity to catch my breath because I was making up for the time that I was gone. So I actually ended up working longer hours after my maternity leave than I had prior to my maternity leave, just to try to keep up. So just having some kind of a way to gradually build up to a full-time schedule would be really beneficial. Training managers, encouraging staff to stay home when they have a sick kid. And I think we're doing a better job of that, especially if there's any fear of COVID. But I still think that is something that we need to be building in. I think one of the things that gets lost sometimes is that we're all human beings at the end of the day. We're all human beings. And so we need that kind of care and understanding that we would want other people to show us. So eliminate unnecessary meetings. That's one of my favorite parts of COVID. So many of the meetings that I used to attend are now an email, and that's how we need to leave it. Communicate expectations clearly. All staff be able to control their own priorities as much as possible, and utilizing an ideal schedule. Next slide, please. So part 2, self-care. Be aware of the must be nice phenomenon, also known as can't say no. And I think this is particularly difficult for women, but I am sure it is also difficult for men. I know that in the culture of my law office, it is certainly expected that if somebody's birthday is coming up, or somebody needs you to cover because they have to go to the vet with their pet, or their kid is sick or whatever, that you would always say yes. Like, even if you had a conflicting court date, even if you whatever, if there was any possible way you could handle it, you should say yes, instead of saying like, well, can we check with somebody else? And so I think that's super, super important. The basics of self-care that we all know and hear all the time: sleep, rest, proper diet, exercise, vacation, renewal, activities that replenish you, working part-time if feasible. Like, if you're really burned out and you just need a break, is it possible to cut your hours for a short period of time? Nourishing activities every single day, access to regular debriefing process. I think this is something that should be built into almost any workplace where you are dealing with human suffering. And I don't think that it is at all baked into any law firm or any kind of legal situation that I'm aware of. I think the medical profession is way ahead of us, as are social workers. Let your compassionate voice speak. So really having self-compassion, I think, is so important, especially with the additional stressors of COVID right now, and making this all a priority. Next slide, please. Okay, so developing those self-awareness skills, some kind of daily meditation or relaxation training, controlled breathing and visualization, trauma stewardship. I actually have my little trauma stewardship book here, which is super helpful if you're interested in further reading. And then body awareness. So one of the things that I do that's very simple is I just do sort of a quick scan. When one of the first things I do when I wake up or right before I go to sleep, I'll just do a quick scan and see where my body is holding tension. And I'll just start at my toes and kind of in my mind's eye, like, you know, like a scanner, like a Xerox machine or something, go up my body and see like, okay, where am I holding tension? How does my body feel? And just notice those things, not in a way of judgment, not coming from a place of judgment, but more just acknowledging like, hey body, I see you. I see that you're tense here, or I see that you're whatever here. And I just take a few minutes to just breathe healing. Like in my mind, I think like I'm breathing healing into my ankle, or like whatever's bothering me, or whatever feels a little bit different or tense. And it literally takes, a minute. It's no time at all. But just baking that into your daily ritual as a habit pattern, I found is really helpful. Next slide, please. So this is mindfulness-based stress reduction, and this is exactly what I was talking about. So just having that mind-body approach, and doing like a scan or a meditation, relaxation training, just strategies to become more aware of how tied in our body is to our mind, and vice versa, and really tuning into noticing. And that's what I try to tell myself. I try to tell myself, like, I just am noticing where I am, where my body is right now. I'm feeling my sit bones sink into my office chair. I'm feeling my back against the cushion of the back of my seat rest. I'm feeling my feet grounded into the floor. Just noticing without judgment, without any harsh thoughts, just noticing where I am. Next slide, please. So incorporating these things, it can be a sitting meditation, but it doesn't have to become some huge ordeal. I found that for myself, if it's something that I can just bake in my daily routine, I'm much more likely to do it long term than if I make it like an hour-long sitting meditation where I'm facing the rising sun and I have this certain kind of pillow, and I have like, it just becomes something that is like, yeah, maybe if I get to it, right? It's one more thing on my to-do list. But if I can do something just very small and incremental, it can really make a significant change without being overwhelming. Just informal practices. And one of the other things that I do, and we'll talk about this a little bit, but on the drive home, like, so there's for most people, there's a separation between the physical location of where they're working and where home is. And so making a mental checklist of, even if you've had a rough day, what was one thing that went well today? What was one thing that I'm proud of? What was one thing that I need to work on? What was one moment of joy that I noticed? You know, like the other day, there was this kid in the clinic and it was a little baby, and the baby was just laughing and laughing, just totally full-throated, full body laugh. And every adult that could hear that child laugh, I could just see their bodies immediately relax and smile. You just can't help yourself but to feel, just to feel lighter hearing a baby laugh like that. And so just that kind of thing, taking advantage of those moments of joy and noting that as a practice every day, noting what was joyful, or what made my job good today? What did I do well? Next slide, please. So trauma stewardship really is looking at how can we remain grounded in our own self-awareness while we are dealing with difficult things. And so one of the things that I talk to my learners about is I talk to them about being in a role. And so while in that role, we are professional and we are listening, we are compassionate, but when we step out of that room, we can debrief and we can talk about how that felt and other things, like where they felt it in their body, where they were stressed about that. But in that role, you can remain grounded and calm and compassionate. And so I really try to think about it like I'm putting on my suit jacket. I'm going into work. This is my uniform, and that's the role that I'm in that place. And I can remain grounded and think about my self-awareness. But in that moment, when I'm dealing with a person in crisis or I'm dealing with human suffering, I'm present for them. And then moments later, we can do a debrief and we can talk about our own body awareness and where we were. Next slide, please. So I think this is maybe the most important thing that we'll talk about, but really making a formal, tangible commitment to yourself. And this is from the Green Cross Standards of Self-Care that was actually developed after the Oklahoma City bombing. But making something specific and measurable to yourself is in baking, like that, this is how you really bake it into your life, right? It's like one thing to talk about, but it's another thing when you really make a commitment to put that Post-it note on your monitor after a tough day and list 3 things that went well, or 2 things that went well, or 1 thing that made you feel joy that day. So I really encourage you to actually write out a self-care plan. Next slide, please. So this next part is about resources. And I'll just tell you that next slide, please. I included a power of attorney form. So there's 2 statutory forms. I included one for minor children, and then I also included a power of attorney for adults. There are a lot of scenarios in which you might need a power of attorney if you're in a caregiving situation. If you are taking care of a child that is not your biological child and you don't have a guardianship, a parent can give power of attorney. The power of attorney for a minor in the state of Oklahoma can last up to 1 year, and it can be renewed after that, but you have to complete a new form. The power of attorney for an adult it will be what you write on the form. Unless you can change your mind, of course, at any time. And the same for parents who are allowing somebody to have power of attorney over their child. They can change their mind at any point. And so sometimes, depending on the situation, you really need a guardianship to have more legal protections to have continuity of care for that child. Amy did an amazing job putting together resources. So please make sure you take a look at the community resources and the self-care handouts that Amy included. And then I think we have our references and then any questions. Oh, I guess we should leave this up so you can scan if you want to.
Yeah, I was gonna pop in. So Caitlin actually has shared the link to the Google Doc is out there. But you can also, I know for sure that this works on Apple phones. I apologize. I do not have an Android in my house. We're Apple people over here. So I know it works for iPhones. If it doesn't work for an Android, please do not be distressed. There is a link. But I would just like to add onto kind of what April was talking about. You know, when my mom became sick, she had brain cancer. And so, you know, there was a point in time in which we knew that she would no longer be able to make her own medical decisions. And, you know, my dad was really great about being proactive and getting those things in place. I will say, I think as human beings, we don't like the idea of having to think about our own mortality. It's certainly not something that I like to think about, even though, you know, I'm a liberal arts major and I love philosophy and theology and all of those things. But it's something that we need to plan for. And I think that that is incredibly important in the context of caregiving. We want to make sure that when we leave this world, that we are leaving everything in place for the people that are going to have to take care of us if we get sick, or, you know, the things that we leave behind. So there's a lot of links in the resources, a bunch of different things between if you need food, if you need clothing, maybe you just need parental support, you know, you need to talk to other parents and increase your social capital. But there's also some end of life and kind of getting wills and different things drafted up that I also think is incredibly important. So I will go ahead and just go through the rest of this really quick. There's our resources. This is actually, I don't know if he knew that I kept this, but we keep this on every one of our presentations. This was the drawings that those kiddos left for the folks at the Advocacy Center after they helped them through a really difficult situation. And then we're going to open up for questions. I know that a few people asked some really great questions, but I wanted to leave up our contact information. You know, if you have any questions or anything that we didn't discuss today, please feel free to reach out to any of us. We'd be love to talk to you and help in any way we can.
Thank you so much, all of you. We do have some great comments and questions. I think this one got cleared up in the comments, but somebody was asking about the OKC bombing comparison from early on in your first part, Amy.
Yeah, so we will be, basically what I was saying is we will reach 10 times the amount of deaths that we had in the Oklahoma City bombing, I would say within the next couple of days. I've been saying a week to be generous, but at the rate that we're going, I think it will happen in a few days. And you know, that I think that should help ground us in the implications of, you know, coming around to the holiday season, being someone that has lost someone very dear to me. Those are empty seats at future family gatherings. And I think it's important that we take a moment to think of that. And I just wanted to say, I know that we had some healthcare folks that I know on the call, and I just want to once again tell them how much I appreciate. I know Lindsay's working in a COVID ICU right now, and I know how difficult that, well, I don't know. I can only imagine how difficult that is. So I just wanted to express my appreciation for that service.
Let's see. Michelle commented that she's definitely seen an uptick in retirements of people who are they just don't want to deal with all of the COVID related fallout and changes any longer. Eden asks, how do you help someone who seems to be experiencing one of these issues but doesn't seem to realize it?
So I think that April and I can answer that question, because we found ourselves in that scenario where I was disclosing all these terrible things that I was experiencing, and she had to kind of pull me aside and say, hey, we need to have a conversation. April, would you like to share how you approached me?
Amy was describing to me, she was going through some court records that were really very, very difficult material. And She was talking to me about it, and she was telling me, I think she was telling me that she was having trouble sleeping. And I remember going across the street and getting this book and saying, hey, I am not trying to offend you, but I have found this book to be really helpful when I have experienced some of these same things that you've been talking about. And if you would just take a few minutes to read, and I think I like had tabbed a couple of spots that I thought would be helpful for her. If you would just take a few minutes to just like go over this maybe on your lunch break or take it home with you tonight, I'm happy to discuss it with you at a later point. But I really think that that just taking a look at like just having, I don't know, I'm a real book person if you can't tell. So like just having something tangible to say like, hey, I also have experienced those things. I think that opens up a vulnerable, like an amount of appropriate vulnerableness, and allows you to have a different conversation than if you say something like, you seem to be really off, you have all these problems, coming at it like, hey, you know, I've noticed, you know, that when I was going through a really rough time, these are some of the things that I had going on. And it sounds like to me, you may be experiencing something similar. Is that true? And then as soon as I said it, Amy was like, yeah, but that's not secondary traumatic stress, is it? And I was like, well, why don't you just read the parts I tabbed for you? We'll talk about it tomorrow.
And then I think I came back and I said, oh, thank God, I finally have a name. And I think that there's a power in being able to name the thing that affects us, right? Like there's always this like insidiousness to knowing that something is bothering you, but not being able to identify what that thing is. And so being able to name that thing gave me a lot of, I feel like, agency back, to be able to kind of take control and say, hey, I know, for instance, like my tell sign is super weird. It's not, you know, my shoulders going up. I start having dreams about my mom. And when my mom comes into my dreams, I know, whoa, I am in red zone. I have, like, I'm not a psychologist. I'm sure someone should probably study my brain. They'd find all sorts of horrible things about it. But, you know, like that's just my body, for whatever reason, has chosen to manifest that as its way of saying, hey, hold up, you're going through something and you need to pump the brakes and figure out what's going on. So yeah, April and I are very intimately aware of those conversations because that's how she got me on this this train to begin with.
And I'll just jump in real quick to, and I think if you're in a supervisory position, having those conversations with your staff and colleagues that you may be supervising and normalizing it is important. So during the orientation I have with any learner that comes through our center, this is day one. I talk to them that I don't say if, I say when you experience this on this rotation, and give them the terms then, and normalizing it, saying this is something we all experience, and so they don't think it's just them, and then giving them permission to come to you for debriefings, either informal or formal. I would recommend more formal ones if you're in that supervisory position.
Yes, I agree. Being a supervisor myself, that is something that I have kind of like baked into my supervisory role of, we're not only going to have weekly meetings, you know, with telecommuting to talk about what we're doing and maybe what problems we're facing and problem solve that. We also study a lot of traumatic things. And so part of that also goes back to, and how did it make you feel? What can I do as a supervisor to try to mitigate some of those things? And honestly, it makes it, to me, easier to be a supervisor. It makes the relationship, the work relationship, much more human. And I think that that is important, particularly in the COVID-19 pandemic, because there's no longer the divide between work and personal. You know, when you have people working from home, they're encountering all sorts of things. You have to really become flexible and willing to hear what your employees are going through and help them is the other thing. You know, you got to act on it. You can't just ask them, how are you doing? And then say, okay, well, cool. We'll meet back same time next week. That's not going to help anyone. So I definitely agree with that.
I did have one person reach out to me privately. I don't know if they were able to tune in during the time frame. They reached out on behalf of someone who is in a basically 24/7 caregiving position, caring for a family member. And hearing April talk, especially when she mentioned about most people will have a separation or a distance between work or their place of caregiving and home. Do you guys have any suggestions? I guess it made me curious. Do you have suggestions on tips or ways of getting time for yourself, taking that moment to care for yourself when you are in that 24/7 living with that person caregiving situation?
Yeah, so I would say it doesn't have to be some kind of, set aside 5 hours or whatever. But even if you can just, you set it like, for my toddler, I can set up a meal and put on his favorite cartoon, and then I can get, maybe 2 or 3 minutes. And so usually what I'll do in that situation is I'll just make myself a cup of hot tea, right? Something simple but soothing, and just making an intentional effort to take care of my own needs, making sure I'm drinking water, making sure I've been able to take a bathroom break, making sure that I'm clothed, and all of those types of things. I think it's really helpful. And sometimes it's really difficult when somebody needs you constantly, it really wears on you. So even 5 minutes to walk out to the post office or whatever, right? Like walk down your driveway or whatever. I think even that can be really helpful. One of the things that I really love to do is I love to get my hot tea, and then I'll just stand at the kitchen and look out the window. And it's maybe 2 minutes, right? And I'm within reach. If he really needs me, I can just go around the corner and take care of him. But just having that kind of reset time, even if it's just a minute or two, really helps me to be a better caregiver.
I agree. And, I think I was one of those people that I would always listen to these self-help talks, and I'd get really geared up and be like, I'm going to do all the things, and I'm going to have green smoothies every day, and I'm going to go on nature walks, and I'm going to have this spiritual reawakening. And then by 3 days in, I'm binge watching Netflix. It's asking me, do you still want to watch 10 more hours of The Office? And I'm eating a double cheeseburger or whatever unhealthy food. And so I think that, what it comes down to is self-care is going to look different for everyone. I think for the longest time, there was this idea that like self-care looked a certain way, that it could be prescribed a certain way, that everyone needed to do it the same. But all of our situations are so vastly unique because we're all human, and, we're all kind of doing our own human experience. So it is really important to just find ways that we can bake it into our day-to-day. You're not going to be able to go on the mountain hike and necessarily have a spiritual reawakening in a cabin in the woods or whatever. But like April said, one of the things I love to do, at least until the weather gets cold, is I walk out barefoot each day to get my mail. And there's something about my foot connecting with the grass that for whatever reason I found helps ground me, and it kind of rejuvenates my mind for the second half of the day. Like I never thought seeing the mailman would make me so excited. Like usually all I get is junk mail, right? Like I don't get anything that exciting, but I get to go outside and do that. And so I think it's really reframing our brains to say what's going to work for me, not how am I going to work for this prescribed method.
Thank you so much. I know we are just about at our time. I don't know if you have time for one more question. Okay, so kind of on the opposite end of the spectrum now, obviously with COVID and everything, we have people who have family in care facilities that they're now no longer able to visit. And this kind of delves more into the actual caregiving side rather than caring for the caregivers. But do you have any sort of like advice or things to look out for? Like I know that I have a friend who has been struggling. They're not able to go visit their parent who is ailing and in poor health, and they're not getting the proper care they need at that facility. So how do they navigate addressing that? Who do they report to, or who can they contact for help caring for somebody that they can't actually go and see, and it's causing them stress as the caregiver remotely?
So
April, oh, sorry, go for it, Mike.
So I think this is so difficult. And one of the big things that we are seeing, and even talking about doing like Zoom visits or FaceTime visits, that's just not the same. So one expert I heard, again, like April, listening to podcast or maybe even NPR, was talking about just writing an old-fashioned letter. And it's the way people used to communicate. And I think that particularly if they have a family member that's in a nursing home, they probably kind of grew up maybe writing letters as well. But writing them a letter and letting the staff read that to them, I think is one way you can communicate, in addition to using electronic media to do that. So it's just, even if it's just a note, my wife has a friend that has been doing that to her, sending her just a card a month just to check in with her. It's just been something that's been kind of nice. So I'll let April give her guidance.
So I have a couple of thoughts about this. The first one is most facilities have some kind of window that you could be able to even just like, they could wheel them to the other side of the window just so you could see them and physically wave to them, even if you couldn't have a conversation that way. And that's just like the human part of me. I agree with letters. I think that's a great idea. A lot of the staff at nursing homes now are using FaceTime or some other kind of mechanism to allow the people in the facility to still have those conversations with their family members. If they're worried that the person in the facility is not receiving adequate care, I would do probably two things, depending on if it's a Medicare facility or not. There's an omnibuds person that's in charge of the Medicare run facilities or Medicare accepting facilities. And so you can make a report of neglect. You can also make an APS, Adult Protective Services report in the state of Oklahoma, to DHS. And you can call the DHS hotline number and just say that you're making a report concerning care of an adult, and they will go and do an investigation. My understanding right now is that the APS is pretty understaffed at the moment, but if there are enough concerns, they will certainly still investigate. It's just a matter of timing on when they would be going out to do that investigation. So I would say those two mechanisms, if you're really afraid of neglect, that's what I would be concerned with. The other piece is I would probably reach out to that person's primary care provider. They're likely not within that facility, and they may have other ideas. Maybe they need to be more clear about what needs to be going on with that person's care, or maybe they themselves can call the medical provider that's in charge of that facility and voice their concerns. And sometimes coming from a doctor or somebody seen as a position of authority, that's a little more effective for medical facilities like that. Any other questions about that, or is that helpful?
I do have a link, Caitlin, in the resource sheet that is for Adult Protective Services. And it includes the phone number that can be called specifically if there's concerns for elder abuse and things like that. So what I would say also, if anyone's experiencing a definitely close to end of life care and they're needing hospice, personally, my family received assistance through Clare House in Tulsa. And I will just say, I feel like they are like the hidden gem of Tulsa, and I will sing their praises until the day that I die, because they are basically, you get your own room. It doesn't feel like a medical facility. It feels like a home. The caregiver that's staying with the person, you actually get your own bed. They have nursing staff. They have people that bring in food, and it's completely free. And it is such just a wonderful resource to be able to know that your loved one is being taken care of and that you can just focus on being present, which is, I think, the most important thing in those times. So there's information in that in the resource sheet as well.
Thank you so much. I know we tried to get my own grandmother into Clare House when we found out about her failing health, and they were just so full, which it's great that they're able to offer that much care to people. So they are a wonderful place. All right, I don't see any other questions. So thank you guys so much. And to everybody watching, I did drop a link into the comments and I can share that again. You guys drive the events that we bring to RSU here at the library. So take a moment if you can and let us know your thoughts on today's event, what you enjoyed about it, what other types of events you would like to see us bring to RSU and the library here. And then Chad, just again, thank you so much. Amy, April, Michael, thank you so much.
Thank you for having us.
Thank you. Have a great day, guys.